Good morning, everyone, and welcome to this live stream this morning. My name is Neil Harris, and I'm from CELT Cardiff. We're an OET premium provider for both nursing and medicine, and I'm delighted to be here today to take you through this step through of reading part A. Now, reading part A in certain respects is the easiest part of the reading a paper. However, people do make the point, and quite rightly so, but how can I possibly successfully answer 20 questions in 15 minutes? And this is a real challenge. So therefore, what I'm going to do today is really talk you through this process of how to make the best use of the 15 minutes that you have available for this part of the test. Because the good news is, yes, it is possible, and I'll show you how. So if everyone's ready, let's start our overview, first of all, of reading part A. So the first thing to say about part A, let me take you through the agenda. Let me just talk you through the things we'll be looking at this morning. I'd like to begin with a very brief overview of reading part A. I'll then look at the three parts of the test and the matching questions, followed by short answer and then sentence completion. So let's make a start with the part A overview. So part A, what can you expect? Well, really, by the end of this session, what I'm hoping to do is giving you an understanding and a better ability to use appropriate strategies for part A. We'll look at those three parts of the test, as I've mentioned. And so I'm also hoping that you will be better able to do this within the 20 minutes that is allocated to you. So the focus of reading part A is this. As we know, you've got 20 questions in 15 minutes. Feels a lot, doesn't it? And what this part of the test is looking at is your ability to locate specific information in a quick and efficient manner. And you might ask yourself, well, how do I do that? And the answer is you need to have the ability to skim and scan quickly across different texts. Remember that there are 4 texts in reading part A, so that you can find particular information which you copy directly in the case of the short answer and the sentence completion questions. For the first part of the test, you're just basically deciding which of the passages the questions come from. So I think it's worth starting by asking the question, well, actually, why do I need this skill? When is it useful for me in the workplace? Because, of course, one of the most important things to remember is that OET is designed to give you skills that will help you at work and to test skills that you are probably already using at work. And that's a real positive, because we talk about backwash. We talk about the way in which the exam has a positive backwash, has a positive effect on how you do your work. So if I can just give you a few moments to be thinking about this very question, when do you use this skill in work, and how will being able to do the reading part A better also help you to be a more competent and a more effective nurse or doctor in the workplace? So let me just leave you with those questions for a few seconds. Well, I'm guessing that one of the things that you're hopefully thinking about already is that this is a genuine workplace situation. So I often use the context of an admission, where you have a patient who arrives and you've got multiple documents you need to look at in order to make a decision. There may be protocols for the treatment of a particular condition. There will be the patient notes, so that's 2 separate documents already. There may be further documentation that's provided, And in fact, if this is something you're less familiar with, there may be some guidelines to the actual condition itself, because, you know, obviously we can't remember everything about every condition all of the time. So that is the idea of the reading part A. It allows you to really get to grips with one of these situations where you need to be able to deal with multiple texts simultaneously. So let's find out how to do it. Let's see how that translates to an OET test environment. Well, you'll have 4 short texts, all relating to one healthcare topic. And the 20 questions in reading part A, as I've mentioned previously, will be divided into these 3 particular stages, which you can see on screen now. So let me just give you a few seconds to have a look at the question types and refamiliarize yourselves with that. Okay, so how do we do this? What's the best strategy or strategies? Well, it can be quite daunting, can't it, on exam day when you come in and you see something like this, 4 texts in front of you. And many people that I work with, particularly those who admit to finding reading part A difficult, say, I panic and I try and read all 4 texts carefully because surely I need to understand them in order to answer the questions. And let me say to you immediately, no. On exam day, leave the texts aside for initially. Don't read them. There are more important things for you to be doing. Besides the text booklet that contain the 4 texts, and for those of you joining us this morning, just to remind you, please, that what we'll be using today are the texts taken from the OET website and sample test 2 to do with paracetamol overdoses. What you'll also receive on test day is the question paper. Now, good news, it's not as small as as you can see on my screen share here. That's the good news. You'll be able to read it much more clearly. It'll be full size. But what this does do is allow you to see how the different parts of the text are laid out, or sorry, of the question paper are laid out. More of that in a few moments. Okay. So questions 1 to 7, matching. And what I've done on this slide is shown you what the question paper looks like. And I'd like to begin with a matching quiz, just to get you thinking about the strategies and what you should be doing. So the question is this. I should first read, and here are your options, A, the texts in full, B, questions 1 to 7 in full, or C, the topic and subheadings for the 4 texts only. So your options are A, B, or C, and it's for you to decide which one is the best one to use here. Well done. For those of you who have chosen C correctly, that is what you should be doing. Avoid reading the text in full. That'll take away time from you that you simply don't have. And don't read the questions at this stage either. I know that sounds a bit weird, but the first thing you really need to be doing is to focus on the topic and the subheadings, because that's going to really help you to get your head around how to do this effectively. So as I look through chat right now, and thank you to TJ, a shout out at this point for TJ, who is the digital marketing guru and the man behind the success of all of these live lessons that we have. Yes, absolutely. You should be reading the topic and the subheadings. I also notice a question, which is a really good one, that asks, is the reading exam, the sub-test, the same for doctors and nurses? And in fact, yes, it is. It's not just the same for doctors and nurses, but it's the same across all 12 disciplines that OET tests for. It's the speaking and the writing tests that are different for the different areas. So doctors will do the same reading and listening as the nurses, but then the nurses and the doctors and the other professions will have separate writing and speaking tests. Okay, so let's move on. So as we can see, C is the right answer. Well done, fantastic. So what we need to be now just focusing on is that information. And if you've got a copy of the passage in front of you, if you've printed it out, you'll be able to see that the text heading is paracetamol overdoses. And then you should be looking, as answer C suggested, at the 4 subheadings only. And let me just bring those up on screen for you now. So for those of you following this on computer, you've got the ability to see them clearly. So paracetamol, contraindications and interactions, procedure for acute single overdose, paracetamol poisoning, emergency treatment of poisoning, and finally, clinical assessment. Now, I think what it's useful to do at this stage is to take each of these subheadings and try and reword them in your own words. Because this process of paraphrasing the subheadings is a really helpful way to get you thinking about what are the key ideas, the core concepts in each. So if we go through them one by one, let me just go to my next slide. How might we paraphrase contraindications and interactions? Well, at this point, obviously we're thinking about drugs that don't go well with paracetamol, and what happens when paracetamol is taken with something else. And I've reworded that as when not to use paracetamol, its effects if used with other agents and other medicines. It'll become clear why this is such an important stage in a few minutes. So for B, procedure for acute single overdose. Again, let's have a think about how we might reword that. Well, if we think about the word procedure, we'll probably think about things to do, processes, steps to take. So how I reworded this one, trying to make it as clear for myself as possible, what to do when a patient has taken an overdose. And notice how I've taken the word acute and seen that as a one-off overdose, not a chronic addiction, if you like, to paracetamol. Or rather than chronic addiction, chronic overuse and misuse. C, paracetamol poisoning, emergency treatment. And I think here the key word we need to be thinking about is the word treatment. So we could turn this into a verb. How to treat paracetamol poisoning. And then finally, the final one, clinical assessment. What would we be thinking about when we consider the word assessment? Well, here we could look at checking, assessing, reviewing on admission patients who have taken a paracetamol overdose. Now, while you might think that this process of putting these subheadings into your own words, it takes time, and yes, it does, what it enables us to do when we come to deciding which of the 4 passages, A, B, C, and D, our answers come from, by having gone through this process, it actually makes the ability to decide much easier. Let me show you how. So for the first question, we're asked the various symptoms of patients who have taken too much paracetamol. In which text can we find that information? Now, on the right-hand side of the screen, you'll see in black the original subheadings, and in blue, the way we've reworded it. And you think, well, which of those four fits best with various symptoms? And I would suggest the following. A is nothing to do with contraindications and interactions. Likewise, B, there's nothing there about procedures. C, there's nothing about treatment. But if you think about the meaning of assessment, that also means thinking about what symptoms that the patient presents with. And therefore, this is considered to be the correct answer. So these are the processes we're going through. We're matching keywords in the question 1 to 7 with our understanding of what we see in the subheadings only. We're not in any way reading the text at this stage. We are simply matching the question with the heading. Okay, let's try another one. So question 2 asks us, which text is going to give us information about the precise levels of paracetamol in the blood which require urgent intervention? Well, again, A, nothing really there about interactions and contraindications. I think the key word here is level. B, procedures. It's not really a procedural step-by-step here, is it? C, paracetamol poisoning, treatment. Well, if you've glanced, and as many of us will do, at the text, you will realize that text C has lots of numerical information presented as a graph, and that would therefore appear to be a possible match because that indicates levels. But you might also reasonably think that, well, you know, if we're looking at levels, it could potentially maybe be D as well. And that is the point here with these first 7 questions. Don't be frightened of thinking it might be one of 2. That's okay, because once we've gone through these and decided the ones we think it is, then we read the text and we check. What we're not doing is reading the text carefully first. We are predicting our answers. I'll do one more with you, and then I'll give you the opportunities to have a go at some of the remaining questions. So question 3, the steps to be taken when treating a paracetamol overdose patient. Now, already, I think you'll be thinking, aha, yeah, I know what to expect here, because you have already thought about the word steps, processes, procedures, as we talked through the meanings of A to D. So very quickly, I think a number of you will be saying, oh, well, that's probably going to be in B. So A, not relevant. B, notice that kind of match between the word steps and procedure. C, not relevant. D, and notice here that D is about assessment. It's not about treatment. So we've now got a good anticipation that the answer for question 3 is going to be B. So what I'd like you to do now is have a go yourselves at questions 4 to 7 and make a decision about what you think are going to be the possible matches A to D. Now, I've been practicing this a lot and I teach it, so I can probably now do this in probably about 20 seconds per question. I'm going to give you a little bit longer here. I'll give you 3 minutes to have a think about what you think are going to be the best matches. And do feel free to pop your answers into chat. Okay. So I'll go through these slowly. The first one you're looking at, question 4, is in which text can you find information about whether paracetamol overdose was intentional? And as I say, do feel free to pop your answers into chat. Just trying to keep up with your answers in chat on my phone as we speak. Okay. The next question, in which text will you find information about the number of products containing paracetamol? The number of products containing paracetamol. Question 6, what to do if there are no details available about the time of overdose? What to do if there are no details available about the time of the overdose? And finally, for question 7, in which text can you find information about dealing with paracetamol overdose patients who have not received adequate nutrition? Great to see a number of you joining in, posting your answers into the chat. That's great. Keep it up. Well done, everyone. Let me talk you through the answers now then. Okay. Well, question 4, whether the paracetamol overdose was intentional. So I think this is the point you can imagine on the point where the patient comes in, and if you're able to discuss it with them, you might be able to ask that question. Did you intend to do this? It's all part of the initial kind of checking the patient, assessing what's happened. So if you chose the answer there for D, well done. Okay. If you think about question 5, the number of products containing paracetamol, notice here in question 5, they don't use the number of medications. It's more general. But obviously here, we're talking about an interaction, or one product and another product coming together. So if you chose A for number 5, you've done well. Sudhey here in chat, who's put in his her complete set of answers. Hi there, Sudha. And so she's got D and 5A correct. Let's see how Sudha has done for question 6. What to do if there are no details available about the time of overdose? Notice that what to do. Now, interestingly, isn't it? We actually use the words what to do for B. And yes, there's the match. And then finally, dealing with paracetamol overdose patients who have not received adequate nutrition. Dealing with patients, that's to do with treating them. and therefore you may well choose option C. So Sudha, well done, because I don't know if you've used this strategy before, but of the 4 questions that you've answered in chat, you've got 4 out of 4 correct, and you've not even read the texts. And that is the key point here. What we're aiming for is the accurate prediction as quickly as possible of which answers are likely to be correct for the first part, the matching questions in reading part A. Now, of course, once we've predicted our answers, clearly at that point, you need to go to the texts and check. If you remember from one of the earlier questions, we weren't quite sure. We thought, well, possibly the answer, this is question 2, it might be C or it might be D. And that's absolutely fine, because what you need to do is, once you have anticipated your answers, you've predicted them, is you then need to look at the texts and check and see if you can find the answers. Now, I'll go on to this next page now so that you can see what the answers are. But what I would very definitely be recommending is that in your own time, because this is a step through, go to one of the other sample tests on the OET website and have a practice of this. So let's just quickly review. You look at the heading for all 4 texts. You look at the 4 subheadings. If one of them doesn't have a subheading, quickly glance at the passage and decide, well, you know, what's it for? What's its purpose? What's the key information in it? And write a subheading, and then base that for your predicted answers, which at the end of the quick, I think it's this one, I think it's that one, you then read the text to check. Interestingly, with the nurses and the doctors that I train to work with OET, I'm finding they tend to get about 5 out of 7 correct without even reading the passage. What they then do is they read the passage and they sometimes change their ideas. And that's what you're meant to do. But if I can just quote Sudha here in chat when she says, your paraphrasing technique is excellent without the reading text. I got 4 out of 4. Yeah, Sudha, and everyone else is joining us here today. That's the point. It works and it saves you time. Now, some people ask me the question with reading part A, does it matter which order I do the sections in? Yes, it does. Please, please, you must begin with reading matching questions first, because this quick idea of finding out, predicting which text you think it's going to be in and then reading the text is going to give you a really good familiarity with what the texts are about, which you then need for the slightly more, demanding set of questions which follow, questions 8 to 20, where you not only have to know which text to look in, but you then have to take information out of the passage. So let's have a look at that next. And before we do, just a quick, my top tip number 1 for all of you, don't waste time reading the text first. Match using the topics and the subheadings and then check. And to be honest, if just this one slide here is what you take away from this first 25, 28 minutes of today's step through, then that's great. That's enough. Okay, so the short answer questions. As I've just mentioned, you've now got good familiarity overall with the what text has what information. So that enables you to move on to the next stage, questions 8 to 13, the so-called sentence completion. So, sorry, that's a mistake there. That should say short answer. So basically you get given a question and what you have to do here is answer it. Okay, if paracetamol is used as a long-term painkiller, what symptoms may get worse? Now, I would imagine, and let's just try this in chat, what kind of information do you think question 8 is looking for? If paracetamol is used as a long-term painkiller, what symptom may get worse? And I'll just wait for you to type some ideas into chat here. Do you think we're looking for a symptom? Oh, okay. Reba, thank you. You've put in the word headache. Okay. And if you think about the meaning of the word headache, what is headache? It's a symptom. So what we can do for questions 8 to 13 is decide from the question the kind of information that we're looking for. Oh, we've got floods of answers coming in here. We've got headache, side effects, complications, and effect. And someone's put in text A. Okay, so there is one more thing that we can look for here. And that is, yeah, Mariamma, where you've written symptoms, good. Yeah, the answer to the question for 8 to 13 is contained, if you like, or the clue is contained in the question itself. So one more thing that we can do, once we've identified what kind of answer we're looking for, we can also think about a little bit about word class. Let me explain what I mean about word class. Word class means things like noun, verb, adjective. Okay, so if we look at question 8, if paracetamol is used as a long-term painkiller, what symptom may get worse? I know that I'm looking for a symptom, and I'm therefore looking for a noun. And this is a really useful strategy to use when looking at these next set of questions. So with that in mind, here are some suggestions, and I'd like you to decide for the following 4 tips, which ones are good tips for reading part A, questions 8 to 13. So there are your tips A to D. What you need to decide is which of those are good tips for the completion of this part of the test. And again, I'll just wait a few moments to see what happens in chat. Okay, as answers start coming in, if you've said B, well, absolutely, that's what the first question I asked you was, what kind of information are we looking for? You said symptom. There we are, that's in C. D, the word class, noun. Yes, this is also a really useful one. So we can certainly say C and D are useful. Salman and Mariama have suggested A, underlining keywords, definitely. I just wonder if anyone's going to have any thoughts about B. That's interesting. The answers that have come into chat so far, some of you say A, some of you saying D. Let me show you. All 4 of them are good tips. So A and B and C and D. Let me show you what that looks like. So we're going to have a look at question 8 together. And as before, you've got on the side A to D, the subheadings from the original passages in black and my paraphrases in blue. Let's see how using these 4 suggestions work. So I read the question again, and I think about my keywords, and I underline them. Long-term painkiller, symptoms may get worse. And I think about, well, which symptoms may get worse, and I make a prediction which passage I think it might be in. I think it's a symptom, I think it's a noun, and I then look for the answer and I find headache. Let's try the next one. I'll go a bit more slowly this time. to see if I can give you the chance to join in chat. So it may be dangerous to administer paracetamol to a patient with which viral condition? So the first thing we do is we think about our keywords to underline. These are the ones I've suggested. I could, of course, also underline dangerous, administer paracetamol, viral condition. I think about which text this might appear in. I try to predict the kind of information that I'm looking for. It's a condition, it's a viral condition. I realize that it's a noun, and then my answer, HEP. Notice how OET here enables two possible answers, either hepatitis C or hep C. We'll do one more together, question 10. What condition may develop in an overdose patient who presents with jaundice? Those are my underlined keywords. Presents. This is the assessment stage, the clinical stage. So obviously at this point, we're thinking about when you're assessing someone, they have jaundice, and there's your link for the passage. What condition may develop? There we have. We know we're looking for a noun as well. So when we've done this prediction activity, what we then do is we go to the text where we think the answer is going to be found. And rather than reading the whole text, what we're doing is we're now reading specifically for a kind of condition which is linked to the occurrence of the word jaundice or liver disease. And there, as we know our medicine, jaundice, condition of the liver, we actually find quite quickly, because we know that we're looking for jaundice and condition, we get the answer ALF or acute liver failure. Okay, Reba and Sutha, well done. Yeah, you've got the answers. You've done it quickly already. Well done. Okay, so again, what I'd like to do now is just give you a little bit of time to consider what you think might be the answers for questions 11 to 13. And this time what I'll do is we'll do it question by question. So let's begin with question 11. I've underlined the keywords for you, and it's what condition may develop on the third day after an overdose. And what we need to do here is decide which text for question 11 you think this may appear in. Think about the kind of information you need. Okay, I'll just give you a little bit of time to see what you think in chat. All right, I've got some answers coming in. Some of you are suggesting D. Well done. Yeah, it's a condition. It's a noun. What condition may develop? And actually the answer is renal failure. That appears in the third bullet point. Patients may also develop renal failure. Notice not dysfunction. Well done. Let's do the same for the next one, question 12. So we know that we're looking for a drug. It can be administered orally. in a given time period of 10 to 12 hours as an alternative to acetylcysteine. And we may be thinking, well, which text do we think that's in? I've got some answers coming in here. Someone asking, saying it's a noun. Yes, Tisna, absolutely. Some people are suggesting C, some people are suggesting A. Well, the point here is that you then have a look and you decide what you think the answer is. Sutha, be careful. You've said that you think the answer is acetylcysteine. Careful, we're looking for an alternative to acetylcysteine. So if you chose text C, well done. What drug can be administered? Well, that's to do with treatment. So that would give us text C. We know we're looking for a drug and it's a noun. Let's see if we've got any of the correct answers coming into chat. Salman, well done. Salman suggested that the answer is methionine. Yeah, absolutely. Methionine is the correct answer there. Well done, Salman. And well done to everyone else who also thought that would be the answer. Finally, question 13. Same process. Which text? What kind of information are we looking for? What part of speech are we looking for? Now, I'd imagine a number of you would quickly see the link between treatment and treatment in C, understandably so. But remember that OET is testing depth of understanding. And, oh, great. Some of you really quick here. You've picked up on the fact what treatment is used if a single overdose has occurred less than a year ago. We have to read the whole question, not just the first word. So in fact, what we're looking at here is occurred less than a year ago, and it's a single overdose. In fact, the match is better here for B rather than C. It is a treatment and it is a noun. And as a number of you have already suggested in chat, well done here to Salman. I'm not sure if your name is Salman or Michael, my apologies, but yes, whatever your correct name is, activated charcoal is the correct question, is the correct answer. So in other words, to summarize, here are, first of all, are the answers on screen. Just wanted to come up with one point. Again, apologies for the probably terrible pronunciation of the name. Sweet Zin Halang, you've suggested gastric lavage and activated charcoal. Careful here. Notice that the clue is in the question. What treatment, not treatments. So although you've got activated charcoal in your answer, the fact you've included another treatment with it, making it plural, also therefore means that your answer is incorrect. Do read the questions carefully, because quite often in this part of the test, what happens is that people put the correct answer and something else, and that makes it wrong. Okay, so yeah, but well done, everyone. So my top tip for this part of the test is this one. Use clues in the questions. That's not only word class, noun, verb, adjective, but also, you know, get a view of what kind of information are you being looking for, symptom, treatment, drug, period of time, whatever, to help you to find the correct short answer, sentence completion. Sorry, short answer, confusing myself here. Okay, finally, questions 14 to 20, the sentence completion. And that means basically you have a sentence and it has a gap in it. The gap may appear in the middle of the sentence. It may appear at the end of the sentence. Okay. And I've got two simple true-false questions for you here. And they are, use the same tips for the short answer questions with sentence completion questions. So basically, those strategies you've just been using so successfully for questions 8 to 13, should we use those for questions 14 to 20? Is that true or false? And then secondly, make sure that your answer fits the gap. And if it's in the middle of the sentence, like question 14, should we be looking at what comes before the gap, what comes after the gap, or both? So again, a few moments just to answer your questions in those two questions in chat. Is it true, false, true, false, false, true, false, false, or true, true? What do you think? Just waiting now for answers to come into chat. There's always a bit of a lag here, everyone. So because I'm mindful of time, let me give you the answers. And they are, in fact, first one's true. And the second one is true as well. So these final questions, 14 to 20, really are very similar to the second set of questions, 8 to 13. We just need to make sure that whatever we write into that gap fits grammatically and in terms of sense. Well done to Tin Barnes for being the first person to put true, true into the chat with the correct answer. That's fantastic. Good. Okay. So let's have a look. Let's do this step through and see how this works. Suta, you're saying true, false. It's true, true. And for anyone else, you'll see as we go through this why the second question, make sure that it fits the gap before and after, is in fact true. Okay, so this is our question. If a patient has taken metoclopramide alongside paracetamol, this may affect the blank of the paracetamol. So what we need to do here is underline our keywords. And I've underlined taken metoclopramide alongside paracetamol may affect blank of the paracetamol. If we think about the meaning here, first of all, and also the word class, we've got a word the here. So we are looking for a noun. And we're looking for something to do with the something of the paracetamol. So you might be thinking efficacy, impact, words like this. Okay. So we're looking for probably a noun or a noun phrase, a noun with some other words with it. And we also might need to think about which text. Well, we've got paracetamol and another drug. So that's immediately telling me the answer is likely to be in text A. So I'm looking in text A for something to do with the manner in which paracetamol is taken up by the body. I'm looking for a noun. And congratulations to those of you who are super speedy here and have written in speed of absorption. Okay, and that is the answer. Now, interestingly, and this comes back to my point earlier, where some of you had answered it was Suta, true, false. One of the answers that's been put into chat is, and I'm not sure whether this is a grammatical error or not, is I saw a speed of absorption. Now, it doesn't work here with the, does it? So in other words, whatever we take out of the text, spelling, remember, is essential because we're just taking information directly from the passage. We don't have to change any of the grammar. We have to make sure that all we write here is what we have at the bottom. Okay, let's try another one. Question 15. Here's our question. After 24 hours, an overdose patient may present with pain in the blank. Okay, so we underline the keywords. After 24 hours, overdose patient may present with pain in the. Now, okay, so this is a patient who is presenting. We're therefore very probably going to be thinking about how we assess them when we're checking them. So this may suggest that we're looking at text D. We then think a pain in the, well, where do you have pains? Well, at this point, it's going to be a body part. It's therefore a noun. And that enables us to now go to what we think the text is going to be, text D, and we're looking for a body part that links to somewhere in the text what to do when assessing a patient who presents after 24 hours. And that comes up with the answer, right upper quadrant. So Reba, well done there. Good. Let's do one more together. Question 16. First 24 hours after overdosing, patients may only have symptoms such as. So again, this seems to be text D because it's to do with presentation. We've underlined first 24 hours only have symptoms such as. So we're looking for an example of a symptom here, a noun. And the answers here I'll put on screen for you. I've got lots of answers coming into chat. Lots of people saying D, well done again. And yeah, the possible answers accepted by OET are nausea, or vomiting, or nausea and vomiting, or vomiting and nausea. They would accept any of those answers. Yeah, I see Reba, Mohammed putting their answers in here. Well done, everyone. That's great to see. Cheston as well, and Tisna. Fantastic. So over to you now for questions 17 and 18. I'm mindful of time, and I do want to leave time for questions at the end. So if I can show you question 17 and just give you a minute or so in order to think these through yourselves. Just looking at the answers coming in, and we've got a bit of a couple of you saying C, a number of you saying A. All right. So a lot to underline here. Acetylcysteine administered to patients paracetamol level above the high risk treatment line. And I think that's the big clue here. We're looking for a text that talks about the high risk treatment line. So if we have a look at passage A, we need to see, is there anything about high risk treatment line? And I understand why you chose text A, because it does seem to be to do with contraindications in interactions. And this is the beauty of this. We're making predictions at this stage, but as we look through text A, quite quickly we see there's not anything about the high risk treatment line. So the suggestions from people looking at parts at C, now we can see in part C, in the graph, there are two lines. There's the high risk treatment line and the normal treatment line. So it would see that test C is going to be the one that helps. Now we're looking for a medication type. So we're probably looking for an adjective or a noun here. And as I look through the answers coming in here, we've got various options: anticoagulants, intravenous, and enzyme inducing. If you look at the second paragraph of text C, patients on enzyme-inducing drugs, they give some examples, or who are malnourished. That's your link with, oh, sorry, I'm jumping to the wrong question here. Yeah, those medications in the second, yeah, okay. You need to look at the graph and the text for this one. Okay, enzyme inducing. Time for one more. See what you make of this one. Suda's super fast here. Suda's completed all 4 questions. Well done, Suda. Mariama's chiming in with a yes. Jojo is suggesting text C here. Well, good, yes. Paracetamol poisoning is an important point here. So we're looking for non-high risk patients, and they're also looking for the paracetamol level. And we've got is above milligrams per litre. So we're obviously looking for a measurement, a number in milligrams per litre. We're looking for a number. Text C seems to be a sensible match. And then the answer here is 100. Good. Okay. I'm going to move forward so you can see the answers to question 19. The answer here is 12. We're looking for a number, for the number of hours that have passed. And our link is with, again, paracetamol poisoning. And then finally, question 20. Here we're looking for a kind of treatment. It's supportive treatment. And that comes up. If a patient does not require further acetylcysteine, they should be given treatment categorized as. So here are procedures, here are steps if a certain situation has occurred, text B. And the reason I wanted to very quickly come to the end here is that I'm very happy just to answer any particular general questions that you have about this step through of part A of the reading text. And to also finish with my final tip, which is for this part of the text, the last set of questions, make sure that your answer fits both sides of the gap if they appear in the middle, and that you correctly spell whatever information it is that you are taking out of the passage. And there are the answers there for you. Okay, so I'm very happy to take any questions, and I'll try my best to answer them for you. But just to thank you very much indeed for spending this last hour with me. I hope that you have found it of use. My name is Neil Harris. As I say, I work here in the UK. I work for a premium provider that specialises in OET for nurses and doctors. We are currently working on a couple of other disciplines for premium level. But I'll just stay around for a minute or two just to see if we have any questions coming in. But it has been a real pleasure to spend this hour with you. Okay, thank you, Sarah. If the answer is speed of absorption and I write absorption only, is this wrong? Well, the actual answer key for that particular question had the phrase speed of absorption, because speed of absorption is ever so slightly a different meaning. So yes, unfortunately, the answer there is wrong. What happens in the marking of the reading is that obviously the first questions, they're right or wrong. What will then happen is that if there is any question, an unexpected answer that hasn't been covered by the answer key, then it will be checked by OET to see if it is possible. But for this particular question, question 14, and if I just go to the question itself, let me just have a quick look. Yeah, it's not the absorption, because when your answer absorption might be the percentage of absorption, 50%, 60%, 80%, but the text clearly makes reference to its speed. So yeah, unfortunately, you need the full answer there. Where is 20's answers? I'll just, there you go. It's on screen for you now, Mariana. It's supportive or supportive treatment. 19 is very tricky, said Suta. Yeah, I think that's, some questions are, going to be tricky. This is a very high level exam. For most people wanting to come to the UK, then, at that point, you're going to need an OET B in reading, which is equivalent to a C1 or an IELTS 7. So yes, I think the point here is that the first part of the test, if you use the strategies correctly, it enables you to get through to the next part with a good set of answers. Remember, for an OET B, you're looking around 30, maybe 31 out of 42. So the more you get right in part A, the less pressure you're on for part B and part C. And I think for many people, part C is the one they find most difficult. Mosa, if we don't find the answer, how will we find what is best to fit? I always say to people preparing for the exam, don't leave any answer blank, because there is no negative mark in OET. So for the first set of questions where you're just choosing a letter, for anything you've got blank, go for the one that you think is best. If you don't have a clue, just put down one of the 4 letters. For the remaining one, really what I can say there is, just put something that fits. It may well be, if it's a condition, you can use your medical knowledge to try to guess. You may or may not get it correct, because of course OET is a test of English, not of medicine. But don't give up. Try putting something in. Okay, so we've got some thanks coming in. Well, it was great. I'm very, very happy to have been able, I hope, to give you some insights in how to answer these questions within the time limit. And I think that's the point. In order to be successful at OET, you need to have a good standard of English. What I've tried to show you today is not a shortcut to success. if you haven't got good medical English language skills. And OET is really keen to give this message. It's really important that you develop good medical English. What I've tried to do is show you, once you've got that baseline level of good language, how you can make the most of the strategies to save you time. Mariama's asking, is there a chance for a class on part C? These live classes are happening, very frequently, and I'm pretty sure if you go and look on YouTube, you will see a part C. But thank you very much indeed, Mariama, for that request. I'll go back to Rebecca, and let's see if we can organise something for you at some point in the future. Okay, everyone, thanks very much indeed. If any of you are about to take the test in the next few weeks, good luck. Really, I try not to say good luck, because it's not about luck, it's about success. So can I just end by saying to all of you, success. It's been a pleasure spending some time with you, and see you soon. Thank you very much indeed. Bye-bye.